In this Get Pregnant Now Quickie episode, we're going to break down a grossly overlooked fertility saboteur that your doctor isn't testing for, but it can actually prevent you from getting pregnant. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant, so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? In this Get Pregnant Now Quickie, you'll walk away with an understanding of why H. pylori is rarely tested for in fertility care, even though it can quietly block your conception, how this gut infection can impact hormones, nutrient absorption, implantation, and miscarriage risk, and when it may be time to look beyond standard fertility labs and explore root causes. So let's talk about why H. pylori is falling through the cracks in fertility care. First of all, H. pylori is really looked at as a gut issue, a GI issue, and not really a fertility issue. Doctors are trained to test for it when someone is presenting with severe reflux, ulcers, gastritis, maybe GI bleeding, or intense stomach pain. But really, what I'm seeing in my clients are fertility symptoms like low progesterone or luteal phase issues, like we talked about in this past Tuesday's episode, low iron stores or B12 deficiency, inflammation, recurrent miscarriage, or having unexplained infertility in general. And unfortunately, those signs and symptoms are not triggering an H. pylori test in the doctor's office, even though this bacteria can directly be an issue for all of them. So, what can H. pylori do to your fertility? When H. pylori is present, it can drive chronic inflammation in the body. H. pylori thrives in a low stomach acid environment, which can interfere with zinc, iron, B12, folate, and vitamin C absorption. And all of these, ironically, are critical for ovulation, egg quality, and also endometrial receptivity. It can increase oxidative stress, which can impact egg quality. It can elevate your cortisol, which we talked about in the last episode, can suppress your progesterone. It disrupts implantation signaling. And studies have even found anti-H. pylori antibodies can be found in cervical fluid and also follicular fluid, and this can decrease sperm motility and interfere with fertilization. So as you can see, that is a big issue when it comes to fertility. Chronic H. pylori infections can elevate pro-inflammatory cytokines, which can lead to implantation failure and pregnancy loss. It's very much linked to hormone dysregulation. It can increase androgen production, contributing to PCOS and insulin resistance. It can suppress thyroid function, which can lead to hypothyroidism related fertility. And so as you can see, it's just adding on all of these issues that stack up against your fertility and your capacity to conceive and sustain a healthy pregnancy. So someone could be eating well, supplementing the highest quality supplements and doing everything right, but their body still can't build or sustain a pregnancy. So let's talk about why standard fertility labs miss it. Most fertility tests are really looking at, can we intervene hormonally or procedurally? And it's really not asking, why are nutrients low despite supplementation and a healthy diet? Why is inflammation elevated, if they even tested for inflammation to begin with, to be honest? Why does progesterone stay low? Why does implantation keep failing? Why does this person keep having recurrent miscarriages? In standard testing and traditional medicine are just asking terrain questions, and H. pylori lives in the terrain. So why testing is often symptom-based? Most people with H. pylori have mild or normalized digestive symptoms, and really they think that bloating or reflux is just their normal. And maybe they have family members who have experienced the same things and they just think it's something that they have to deal with. Or honestly, some people can have H. pylori and have no GI symptoms at all. So usually, unless symptoms are severe, testing is often never happening. And the bigger picture here is fertility medicine in the traditional Western medicine sense is not integrative by design. It's just focusing on like the main aspects, our ovaries, sperm health, hormones, and things like that. It's not looking at gut health or immune health, nutrient absorption, and why those things could potentially be impacted. So that's why H. pylori often gets missed. And another issue here is one of the ways that H. pylori can be shared amongst individuals is through saliva. So if you have it, then chances of your partner having it are pretty likely. And that's even to say, even if your doctor knows that you have H. pylori, maybe they treated you for H. pylori. If your partner isn't also being assessed and looked at, then they could just give it right back to you. And also them potentially having H. pylori can impact their fertility. So it's really something that needs to be addressed functionally. And it is absolutely something that I help my clients with and am currently helping a good handful of clients eradicate H. pylori right now. So let's recap today's quickie. H. pylori is considered a GI issue, not a fertility issue in conventional care, and it can silently disrupt your hormones, nutrient status, implantation, and pregnancy outcomes. And if you've been told everything looks normal, it might be time to ask different questions and stop blaming your body and really looking for the root of what's going on. Unexplained doesn't mean unfixable. Sometimes it just means the root cause hasn't been uncovered yet. And gut health, especially hidden infections like H. pylori, is one of the most overlooked fertility pieces that I see in women who are feeling really stuck in their fertility despite trying everything. So if you want to finally uncover the hidden factors that are stopping you from getting and staying pregnant naturally, use the link in the show notes below to book a free fertility strategy session with me now. No strings attached. What can you lose? Thank you so much for listening. I hope you have a beautiful day. Stay warm, and I'll see you on our next episode released every Tuesday and Thursday. Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. You'll find the link in the show notes. As a quick reminder and disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.